WHO coming to support in catalyzing scaling up of high-impact innovations, communicating successes and lessons, and later on you will see how the marketplace has been brought, where all the innovators can come in and present their views, ideas. In system strengthening, you'll see there's a need for coordinated mechanism for all the stakeholders, including the private sector, to come on board and use the institutionalized setup at the country and to help scale up the innovation at the highest national level. And countries are developing investment case, that's not new. Even Uganda, you need to, as innovators, need to develop an investment case and incentivize innovations and innovators like yourselves. Now in the regional strategy, you will see these very many components. High-level country leadership. What I can tell you for sure was after the innovators, the 3 innovators won, they were recognized by the national leadership here. The president himself recognized the innovators. It was in June 2019, right? So there's a need for high-level country leadership to be engaged, generating locally relevant innovation pipeline. Sorry, that font is too small for me. My apologies. Or I'm getting old. Okay, we talk about inclusiveness, equity. Those are very important. Affordable, quality healthcare. These are the key words that I'm using here. Collaboration and partnership, including the public-private partnership, gender mainstreaming and equity. We've all been hearing about this and you've attended sessions on this. Intelligent risk-taking. Now all of these ingredients are what you will find in the regional strategy for innovation strategy, the WHO Regional Innovation Strategy. Now this slide, a quick one. Time taken to reach 50 million people, users. The base of innovation, if you look at the timelines from aircrafts to the cars to telephone, I mean, the number of days or years required to reach 50 million users have decreased substantially and will continue to decrease in this day and age of technology and communication. And today, you can see the top trends of innovation are in immunization, social media, the biosensors tracers, the artificial intelligence, immunotherapy, digital health, the 3D printed devices. These are all top technology trends, and some of which we did see in the earlier session today. Now, innovation and development, what WHO considers is an innovation cycle here. The various innovation inputs in the green and innovation outputs in the orange that looks into impact, scale, and sustainability. What is required is for the systems, the innovation systems, the strong institutions in the country, and Uganda has very many, and the technology, all of them to come together. What is required is a platform for the innovators. And that's where WHO is looking forward to. Basically to identify and foster development and innovations, to scale up innovations, to amplify innovations, and to use innovations in various areas of science. We have had good examples. We saw in the morning as well. Various speakers told about innovations. For WHO, we've been promoting innovations in areas of non-communicable diseases. It affects, Uganda is not far behind. We are hit with quite a substantial burden of non-communicable diseases. Vaccine delivery, we've seen that beautiful picture, drone technology delivering vaccines. Not just that, even for laboratories and others, drugs, therapeutics, malaria, reproductive maternal neonatal child health, HIV services, COVID-19, all of these innovations. There is a global WHO innovation compendium where they are all registered and they're made available. Now, WHO regional strategy for scaling innovations. There are various pillars. Now, we looked at the leadership and management, the use of domestic resources, political commitment. Those are the founding pillars which the member state needs to provide. WHO, together with partners, will come in to ensure inclusive innovations, to ensure visibility using marketplaces, to create innovation pipeline with it, where innovators like yourself will have a platform to showcase your innovations, innovation leadership, technical support, mobilizing resources, and partnership and coordination. These are the various areas under the regional strategy where WHO looks forward to supporting the innovators. Now, the marketplace that exists, all of the emerging technologies are displayed there. There's an innovators forum as well. Innovations in science and media and publications. The marketplace provides you with all of these. And this is for all of the African member states. So the regional office is the one that does it. And you will see these are the very many publications that are available. And the compendium, you'll see quite many, and you'll see some of your Ugandan innovators there as well. Tracking of the impact, assessing global trends, assessing identifying the case investment for these innovations. And WHO is also helping the innovators market it to the wider global audience using these platforms. Various innovation journeys. I apologize for that very, very small font. But I hope the presentation will be shared, and please do use that. So it started around 2018 with the first one being called the Innovation Challenge, where 2,500 innovators came on board. And as I mentioned earlier, 44 of them were from Africa, and 3 of the top 30 were from Uganda. Dr. Wayangera, he invented something called Plan Filovirus Rapid Diagnostic Test. Mr. William Wasawa, he won an award for PAP Expert System, PAP-ES, which has evolved more, I understand. He will speak a bit about it. Mr. Onguzu on the National Ambulance Service. These were recognized by WHO as well as the highest leadership in Uganda. So together, WHO looks forward to working with, again, my apologies for that terrible font. Here, what is mentioned here is what is it that WHO plans for Uganda, or what has been evolving. WHO works together with Ministry of Health and Ministry of Science, Technology and Innovation. Under the leadership of MOSTI, it creates a platform where Ugandan innovators can come together. And it's called Uganda Health Innovation Cluster, UHIC. It was officially born in the World Health Summit regional meeting last year, June 2021. But a lot of preparatory work has gone forward.
Yeah.
It's in line with the National Development Plan 3, and it basically is a coordinating platform to bring the innovators forward and to support scaling up of high-impact innovations to accelerate the health outcomes of the Ugandan people. So that's the basic objective of Uganda Health Innovation Cluster. There are documents available on this. And we look forward to support scaling up the impacts, to strengthen the Ugandan health systems, to foster innovation culture, to provide visibility to the innovators as well as the innovations that Uganda has produced in order to address and harness, priority areas, very many areas in health that requires focus in order to achieve the universal health coverage, and to harness innovators to come forward on the priority needs. Also to look forward to coordinate partners using this platform, and to institutionalize mechanisms, standardize approaches to address the various challenges that exist in the healthcare system. So basically, what is emphasized out of this cluster is to create demand, to give areas where innovation can happen, to foster partnership and support, to mobilize resources. Without resources, it's difficult. To assess capacity and, if required, to build them as well. To foster value proposition and to create a roadmap for action. Now, since it was born, it has been COVID, it has been Ebola following that, but we look forward to taking this forward together with Ministry of Health, taking lead, and also support from the Ministry of Science, Technology and Innovation. WHO has expressed its willingness to act as a secretariat and support this cluster. But moving on, I would like to invite William Basara. Please, William, come on board. He's one of our innovators, award winner, and beyond the award winning, he has taken forward quite a bit of work. Please. He will be sharing his journey, good and bad both. Thank you.
Good afternoon, everyone. Yes, I'm called Dr. William Waswa, coming from Mbarara, and in the next 5 minutes I'll be telling you about my journey as an innovator in Uganda and in Africa generally. So as an innovator, in 2016, I'm a biomedical engineer. So in 2016, as I was working on medical equipment, I observed how hard it was for a cytopathologist or a pathologist to examine a pap smear or to analyze a pap smear under a manual microscope. It was time-consuming, error-prone, and also very, very subjective. So I told this gentleman, with the available AI technologies, we can automate this process. He said, "Whoa, William, if you can actually do that, you'll become a world winner, an award winner for such an innovation." And that's how PAP-ES came into existence. So PAP-ES initially was called PAP-ES, which was a pap smear expert system, which was using physiologic and if-else statements to really provide diagnosis of cervical cancer from pap smear images. However, after the preliminary tests, it was not doing what we wanted in a clinical environment. So then we added AI instead of just making an expert system. So it's called PAPS AI, and it's adding artificial intelligence into pap smear analysis. So cervical cancer is one of the leading causes of death among cancer patients, and this is actually due to late-stage diagnosis and misdiagnosis. So PAPS AI is a low-cost digital microscope side scanner that provides real-time, accurate, automated diagnosis and classification of cervical cancer from pap smears. In 2018, it was selected among the top 3 WHO innovations and also recognized by the Royal Academy of Engineering among the finalists for the African Engineering Innovations Awards. So from 2019 to 2020, we kept on improving the microscope and the whole solution. Then it evolved from just being a pap smear system to a fully digital oncology platform. And dear ladies and gentlemen, today we have a state-of-art digital oncology platform that can be used to streamline and digitize cancer care or oncology services in resource-constrained settings. It has a lot of benefits for the cytopathologist because it has a lot of AI to diagnose or to provide image analysis. It has the part for clinical care or patient management. It sends reminders to patients about their due dates. It provides a streamlined flow to cancer management. And this has been recognized and supported by USAID, where we're doing a pilot at the Mount Referral Hospital in partnership with USAID, and also with support from WHO. The Commonwealth Health Ministers meeting in Geneva was also recognized, and also WHO. So as an innovator, because I'm telling you my journey as an innovator, then I'll share some of the challenges. So during the time of COVID-19, that was around 2020, we were piloting our solution, and that's when COVID came in. Definitely a lot of things came at stand, so we had to pivot and put energies in trying to respond to COVID-19. So we also responded to the WHO Digital Hackathon, and actually our innovation was selected still among the top 3 innovations that were supported, and we piloted next-gen COVID AI, which was the state-of-art COVID-19 information management digital suite. So it was used for patient information management, contact tracing, surveillance, resource management, and also inventory management. In each setting, it was supposed to be a national system, but it didn't get an opportunity to reach at the national level, but it was also piloted at Infectious Regional Referral Hospital in partnership with WHO. So we didn't only stop at developing software for taking care of COVID-19, but also wanted to respond to the shortage of PPEs. So we launched a platform which is called 3D It Yourself, where we are using available technology. So we are using 3D printers, and we partnered with COVID Action and the Royal Academy of Engineering under the CARE project, and we actually manufactured over 300,000 PPEs, and those were all 3D printed. We had 6 3D printers, and also teaching nurses how to use available materials to prepare PPEs. So it was basically about face shields that had printed bands, and also just using available materials to prepare PPEs, and also actually 3D printing some medical equipment spare parts using 3D printers. So to date, we are piloting in partnership with QUAM and Open. We are piloting a state-of-art next-generation hospital information management system. This actually has potential providing services and solutions that are offered by systems like HIC. We have looked at all these systems, the available open ELMS, observed some of their challenges and limitations, and we have developed a software. Currently, it's being used in 6 hospitals and has been shortlisted on the Digital Square among African health innovations that can actually be used to streamline or strengthen health care systems in Africa. So it provides a fully automated management for hospitals, starting from patients, but also staff, inventory, farmers, everything about hospital is being digitized in our next generation hospital information management system, and we have a plan of making it open source. And as an international AI leader, I'm also a member of the African Union High-Level Panel on Emerging Technologies, which is a 10-member technical committee of experts in Africa that provides technical guidance to African member states on harnessing emerging technologies, and I'm the chair for the African Union AI Continental Strategy for Africa. What are some of the lessons I've learned as an innovator? One, the health challenges we have actually a great opportunity for us Africans and the young innovators. Let's look at these health challenges as opportunities. There may not be enough jobs for all of us, but we do have enough challenges to actually turn into opportunities. The emerging technologies that are available, 3D printing, AI, blockchain, 5G, these are all opportunities for us. These are all opportunities for us to become job creators, and we can change our environment. However, managing innovation in Uganda is not very, very easy. Some of the issues or challenges I've actually found about networking, you actually find somebody doing what you are doing next to you when you have a gathering like this. So that's why WHO thinking of coming up with a platform where you can meet and know who is working on what is really a good opportunity for us to network and collaborate. Funding is also still very limited, despite the fact that there are at least initiatives like NISI and Ministry of Science and Technology, but still the funding is still limited. The ICT internet is still expensive in Uganda, and if you have a company providing internet for employees, it's not something very, very easy. Buying from the government and ministries, I think that's the hardest. You can easily do business in the private sector, but with the government and private, it's still a little bit tricky and hard. You can't say, I'm taking extensions to a public hospital. It's a little bit hard. And also, it's still a lonely journey. So what to do as an innovator? One of some of the things I have 5 points for you as innovators. First, be innovative. You always have to be innovative in each and everything you do. Resilience is key. If you really want to succeed as an innovator, resilience is very, very key. Pivoting, when this is not doing what you expect it to do, don't just give up. You can always pivot and respond to what's urgent and be able to come back in business. Also, unlearn and learn. Keep learning. The emerging technologies are coming. Data science, AI. If you don't change will definitely change you. Partnerships are very, very key. And my last slide is about what should the government and our partners do. These are actually the 10 points that I've always said that these are some of the things that we have to think about to really streamline and strengthen the innovation ecosystem. Policy alignment, this is very, very key for our government. Partners need to ensure that you have policies that have been crafted to really support innovation in Uganda. Stakeholders management and partnerships, this is very, very key. You cannot implement some of these projects as an innovator alone. You need to partner with somebody to be able to provide this. Nobody is going to trust you when you are moving alone. Ecosystem governance is very, very key. We need to ensure that we have a governor for this innovation ecosystem so that's not a lonely journey. Market strategy to ensure that in Uganda, we should make sure that we support local solutions. This is very, very key. Market shaping to ensure that you do not go to India and or somewhere out and bring an innovation that can actually be developed locally here. Monitoring and evaluation, learning and education, and lastly, knowledge management, IP. These are key things that we need to think about as partners and ministry. Thank you so much.